Magandang hapon po mga katribu and welcome to Kalingang KaTribu. Ngayon po, meron po tayong napakagandang episode dahil pag-uusapan po natin yung mga destinations na tinatawag nilang o itinaguriang wellness destinations. In short, hindi lamang yung naglalakbay tayo para mamasyal, kundi maging mas malusog, mas malakas, at mas maganda. Please welcome Dr. Ariel Baira. Hi, Doc.
Hi, morning, Ma'am Cory.
Doc, wellness destination. Ano kaya ang number one recommendation po ninyo?
Okay, first of all, let me just tell you this, no, that we're trying to change the landscape of an ordinary staycation. So what we are offering now is for this what we call luxury wellness resorts, no, to offer value-added services. And these value-added services come in the form of wellness services. No? Kasi nga, nagkaroon na ng pagbabago even in the perception of health and wellness, no? Especially nung tinamaan tayo ng COVID, no? With the pandemic. No? In fact, we're still probably in the era of the pandemic. No? But now, everyone's focus is on health issues. Kasi nga, to address the problem of how else can we protect ourselves from the dangers and the risk of getting the COVID infection. Especially now that we're having several sub-variants, no? Worldwide, kung saan po present yung COVID-19 infection, and they come in different forms, so meaning the World Health Organization have come up with different variants, especially of the Omicron type of COVID-19 infection. So ngayon, we're also trying to address the problem by providing clients with options on how to improve their overall health. Of course, alam po naman natin na napakahalaga no? We keep saying that health is wealth, no? And we keep on trying to make sure that everyone is conscious about preventive health measures. So, yeah, okay.
Anong ibig sabihin, Doc, pag sinabi nilang wellness destination, mamamasyal sila, maglalakbay sila, maghahanap sila ng resort. So ano yung mga iba't ibang activities sa loob ng isang wellness resort or destination na kakaiba, na wala o hindi mahahanap sa mga ibang lugar?
Yan. Napakaganda ng tanong niyo, Ma'am Cory, no? Kasi ngayon nga, as I said earlier, pinabago na natin yung konsepto ng staycation. Kasi the moment you book in any hotel or resort for that matter, anywhere in the Philippines or even abroad, nag-o-offer na ngayon ng mga wellness services. No? Hindi na lang yung titigil lang tayo sa isang resort para mag-swimming, mag-kumain, mag-relax. No? So, meron mga added value services. And ito ay malaking itutulong sa mga global travelers, no? That of course includes our local tourists, no? Na nagiging batayan na ngayon kasi, I don't know if I have to mention this, but there are two iconic wellness resorts in the Philippines. They are, of course, the Park San Benito in Lipa and Egri Wellness in Balisin. But of course, if you try to look at their portfolio, napakamahal eh. It's very, very expensive.
Okay, let's say let's let us itemize, let's say, the things, a typical day. Let's say, typical day kung magbibisita po tayo sa Anya Resort. Okay, tell us more about the resort.
Okay, so first of all, I am the medical director of European Wellness Retreat Philippines, a subsidiary of an international healthcare organization. And European Wellness group of companies is now present in 37 countries. We partnered with Anya Resort in Tagaytay, in order to offer our services, wellness services for that matter. So we are now setting a new standard, in the evolution of what we call luxury medical wellness resort destination to answer a growing hospitality niche in the post-COVID era. So, binabago na natin yung sistema, na this is very important in order to emphasize how important health issues are. And the partnership provides guests of Anya Resort Tagaytay direct access to our European wellness resort. We call them biological medicine. As
Okay,
well
let's
as,
say
of course,
example,
the,
Doc,
okay.
Example, magche-check-in ang mga magulang. Let's say for adults, no? This is mostly for adults, right? Not for families. Okay.
We do their families also.
Assuming magche-check-in husband and wife at mga kaibigan nila.
Yeah.
What kind of package do you propose?
Okay, so we offer different packages. In fact, just the ongoing package is really for, we call it last month couples wellness packages.
Yeah.
So really husband and wife, or they come to us. Part of the package of booking for Anya Resort is a screening diagnostic test that we provide, so that the clients of Anya will know na meron pala ganung kasi nga para it's just an ordinary staycation. So the clients come to us, and then we explain several machines that we make. These are things, and that includes, of course, several diagnostic procedures that we do as a screening. Kasi siyempre, we have to establish a baseline. So,
okay, so
yung mga couples,
Doc? Okay.
There are families.
Doc,
Okay.
para sa kaalaman ng ating mga katribo, ito, kung marami po kayong mga packages, let's see the packages on the screen now. Ito, ang nakikita natin.
Okay, right now we focus on two major programs that we develop. These are signature medical wellness programs. One is, we call it the Clean program, and the other one is, we call it the Breath of Breathe program. What are these two programs?
Yeah,
First,
okay, one by
the
one,
Clean program. Okay, so the reason why we call it clean, because basically we detox. Kasi ngayon, it's about the word.
Ito mga katribo, yung detox ay detoxification.
Yes.
Yan ang pampalinis ng ating katawan sa loob. So, tatanggalin, Doc, ano ang tatanggalin sa isang detoxification program?
Okay, so our detox program consists of three different detox programs. Okay, one is what we call the heavy metal detox program.
Okay,
which is
ano itong mga heavy metals, Doc?
Okay.
Iisa natin.
So, yun ang isa sa pinag-uusapan natin when clients come to us. Now, we discuss heavy metals because a lot of clients hindi nila alam ano ba yung heavy metal toxins. And when we talk of heavy metal toxins, these are lead, number one.
Lead.
Mercury.
Yung lead, mga katribo, nasa makeup yan.
Yes, makeup, sa toys, and of course, that is gasoline. That's the reason why unleaded na yung gasoline natin. And then we have mercury.
Mercury. Andoon
Yes.
sa isda na kinakain natin.
Yes, exactly, ma'am. Right you are. Kasi even if we cook them, no, hindi naman natatanggal yung mercury. And we're not even sure kung talagang walang mercury doon. In fact, the government has done to take out, no, in partnership with the Department of Health Directive, tinanggal na yung oral thermometer na ang mercury nasa ulo. Diba, nasanay tayo doon noon na may
Yes.
mercury. No, that's one. Another one is, of course, the BP apparatus, the sphygmomanometer. Yung tinatawag nating desktop sphygmomanometer, mercury ang ginagamit doon. No? So right now, ban na yun, bawal na yun. But of course, still, hindi natin maiwasan yung mercury that is taken by seafoods, especially fish.
Oo. Doc, lead and mercury. What are the other heavy metals?
Okay, we have aluminum.
Oh.
Oops, we use a lot of aluminum foils and all those things, no? And then even iron, no, from steel and all these furnitures, whatever we have. Meron din tayong arsenic and cadmium, which are also present in what? Our gadgets. Hindi tayo nowadays, hindi na tayo parang kulang pag nakalimutan na natin yung ating cellphone or tablet or whatever, binabalikan natin eh. Because it's been a part of our lives eh.
Correct.
Pero the exposures that we get through all these gadgets and also increases our risk of getting these heavy metals. In fact, sa European Wellness, no, meron kaming heavy metal and mineral scan, meaning we are able to identify, no, the heavy metals present inside your body, no, and quantify them. Gaano ba kalala yung heavy metal na nandoon? And at the same time, identify kung meron bang kakulangan sa mga important minerals na kailangan ng katawan natin. So, medicine, healthcare, nag-evolve. So now, everything is being diagnosed through instruments na nakikita na natin when before, hindi natin alam yun. So that's one way of...
Ano ba ang resulta o epekto sa katawan ng mga heavy metals?
Oh yes, definitely. Nakakatakot siya kasi lalo-lalo na ang ating kidneys and liver. No? They usually bear the brunt, including the brain. They usually bear the brunt of toxicity. Kaya nga minsan, magtataka tayo, may mga sakit ng tao na bakit lahat na ng mga conventional way of treating these patients, nagawa na, pero it seems na parang kulang pa eh. No? Meron pang mga bagay na dapat natin i-address. And minsan hindi natin alam ano pa ang dapat natin gawin. Sabi ko nga, in any particular treatment na to resolve any medical concern or condition, kailangan siyempre, aside from identifying them through diagnosis, we need to detoxify them. In fact, in the European Wellness, we have what we call 5 pillars of clinical strength.
Ano ba ang epekto sa katawan ng heavy metals? Anong mga karamdaman ang nagiging connected sa heavy metals?
Yes. Of course, yung paulit-ulit, okay, having said kanina na tinatamaan din yung ating kidneys, yung liver, yung brain, no? Marami pang mga kondisyon na pwedeng panggalingan ang mga heavy metals. No? So,
tulad
of course,
yung kinatatakutan ng lahat, di ba, yung Alzheimer's?
Yes, I was about to say that. No? Alzheimer's or what we call senile dementia. No? Kasi yun ay isa rin sa mga bagay na, kasi ang tao, ma'am, minsan, they surrender, no, to the point na sila, kasi matanda na ako eh. In fact, in the test that we do, yung tinatawag naming biological pattern, at the end of the test, there is a portion where it will identify what we call the biological age of a patient, yung bang cellular age, compared to your chronologic age. And that is the one that most of our clients are so interested to find out.
Okay.
Kasi
Mga katribo, ito, para sa kaalaman ng ating mga katribo, yung biological age, ang tinatawag nilang state of health or youthfulness ng isang katawan na hindi kasali ang chronological age o yung date based on your birth certificate.
Right.
So, yung chronological age, ibig sabihin, pwedeng maging mas bata ka kung ang biological age mo ay mas bata rin.
Yes, exactly. Tama, Cory, no? Kaya nga, di ba, minsan ang biro ng tao, the chronologic age is just a number. But how you feel, how you react to the different people that you talk to, and all of this, you can be very, very young. No? So it's also a state of mind, no? Your mindset mo. If you feel like you're very young and you mingle with young people, then chances are you definitely have. And the biological age also is a result of a lot of toxicity. No? Toxicity, the level of stress that we encounter. No? So, ang daming factors.
Sige. Please hold that list kasi ang dami pa po mga katribo na dapat nating pag-usapan sa aming pagbabalik. Huwag po kayong aalis.
Okay.
Magandang araw mga katribo! Narito na ang mga makakasama nyo tuwing umaga sa programang Gising Na. Roy Pelovelo, Atty. Lia Badillo Crisostomo, Vernon Velasco, Kim Sancha at Chert Balagtas. Abangan ang programang Gising Na sa Facebook page ng Daily Tribune.
Ilabas na ang mainit na kape at samahan kami sa inyong pag-almusal, mga katribo.
Simulan natin ang bawat umaga with good vibes sa mga informative and recreational segments ng aming programa.
Maaari niyo rin ibahagi sa amin ang inyong opinion via Daily Tribune Facebook page at Tribune Now sa YouTube.
Makichika na rin sa latest showbiz happenings, mga katribo.
Kaya naman, pagsama-sama po tayo sa
Gising Na!
Mga katribo, detoxification, cleansing ng ating katawan, na ito po ay base rin ng wellness destination. So the next time you think about a vacation, why not include wellness? Di ba? Nang sa ganon, we can even feel better and be stronger. Dr. Ariel, let's continue.
Okay, so I was saying something about the CLEAN program. Under the CLEAN program, we
Yan
have
ang package 1, first
yes.
package, no?
Yes.
Okay.
So we have as I mentioned earlier, the heavy metal detox program, no? Which is basically a cleansing program. No?
Ano yun? Sa pagkain? Sa iinom, may kakainin?
Yes, meron kaming, we have the hydrocolonics machine. No? We also provide what we call the HMB oral sachets, no? Where pinaiinom namin and then nag-detox ang pasyente.
No? Mga juicing yun, mga juices.
Yeah, juicing, right. Yes, ma'am, right. And then the next is, we call it the deacidification program. It's a gut health. Now, because a lot of patients are suffering from hyperacidity problems.
Oo, totoo yan.
Uso na yung GERD, gastroesophageal reflux disease. No? So, we alkalinize the gastrointestinal tract para na sa ganun, maging mas maganda ang metabolic process sa loob ng ating katawan. And that includes so many of these physiologic functions of the body. So we really need, kasi sabi nga, there are studies coming out now na ang cancer cells no, love acidic environment. So again, kailangan kontrahin natin so that we're pretty sure na we can prevent, no, the onset of any malignant lesions that can possibly.
Okay, so merong iinumin, tapos meron din colonics,
Yes.
malinis lang, para siyang enema pero mas ano yun, mas medical ang approach yung colonics.
Yes, medical approach, exactly.
Tapos,
And then the third,
you have lymphatic.
yes, lymphatic drainage, we do that. No?
So masahe.
Yes. And we have what we call myofascial decompression therapy. Okay, so that's part of the package. So it's like a lymphatic massage. No? So, kasi ma'am, of course, our approach is holistic. No? So, it's not just limited to oral supplementation, juicing, no? The use of machines, but we also provide some spa services in the form of massages, yung decompression, myofascial decompression therapy.
Okay, so that's package 1, no? That's the first package, yung clean.
No, let me go with the third kasi may tatlong under the clean program. What we have is what we call the cellular, no, health program, no? And under this we have to understand that there are 7 channels of elimination. Kasi baka akala lang ng tao ang detox parang sa dumi lang, no, sa pagdumi. No. So we also make use of what we call 7 channels of elimination. So what are these 7 channels? Aside from the colon, okay, we have the kidneys, the liver, the lungs, the skin, the blood, and the lymphatic system.
Okay.
So lahat yun ina-address natin. Now, the package that we come up with, the first 2, yung sa HM Detox and sa Liver Rescue, we have what we call the 4-day, 3 nights package. So we distribute, no, the different services that we have, no, kasama yung booking ng pasyente, no. And then dun sa pangatlo, ito sinabi kong Cellular Health Program, we prepared an 8-day, 7 nights program because each day we address the 7 channels of elimination. Okay, so, for example, day 1, we will have all procedures to address the colon, para colon cleanse. Then day 2, we have the procedures that will address the skin. Kasi meron din kami infrared sauna machine. No? Kasi sweating is a very good detoxification procedure. No? So the more we sweat, because through the sweat, lumalabas din yung ating toxins. No? And then the next program, sabi nga natin yung breathe or breath program, we have 2 because primarily this was done, okay, no? Kasi to address the problem of our pandemic, di ba? Kasi respiratory yung problem natin sa COVID. No? So we have the first program under breath is what we call the immune boosting program. Nauso yung word na immune system. Yes, the defense mechanism of the body. We need to make sure that we are always in tip-top form. Ika nga, para na sa ganun, we can repel or we can prevent the entry of any of the variants of COVID-19.
Ano yung treatments for immune boosting? At saka through the breath.
Yes. So, kanina, we mentioned oral supplements, we mentioned the use of some machines. Dito, meron din tayong IV infusion drips. Okay? Siya yung pinaka-popular because a lot of clients are so familiar with yung mga ina-IV ng vitamin C with glutathione. So parang, but in our case, no, we have 7 different IV infusion drips. No? So tinitingnan natin. In fact, we also have a drip specifically to address problems of fatty liver, yung metabolism enhancement drip. Of course, meron din tayo yung antioxidant drip. Meron pa kami tinatawag ng optimum health drip. No? We have several drips depending on how the patient or what the patient would need.
Okay. Doc, bakit yung drip ay sinasabi ng mga doktor mas epektibo kaysa pag-iinumin natin yung supplement orally?
Okay. Kasi, obviously ma'am, pag IV drip, it goes directly to the blood mainstream. So, dire-diretso, mabilis. No? I-associate natin yan isa pag na-hospital ng pasyente. No? And there is a fulminant or a full-blown infection. No? Anong ginagawa namin mga doktor? We give the antibiotic directly through the vein kasi mabilis ang reaction ng katawan.
Yes.
So, ganun din yun. Aside from being mas mabilis, siyempre mas epektibo. Now, of course, for all practical issues, hindi naman everyday na, okay, the patient should get IV drip. No? Kaya nga sinusundan na natin ng mga oral supplementation. Kasi nakapag-start na tayo addressing the problem through the mainstream blood. No? And then it can be followed up by oral supplementation. Kasi siyempre sa oral supplementation, medyo mabagal-bagal ng konti, unlike the IV drips.
Okay. So, Doc, kaya ba ng 3 or 4 day stay or 7 day stay sa Anya Resort na mararamdaman na ng isang pasyente, mararamdaman na niya yung pagbabago sa kanyang, I was looking for the right word, pagbabago ng kanyang kalagayan?
Sure. In fact, that's the reaction of most of our clients who underwent these IV preparations, the programs that we have. Natutuwa sila. Of course, we always emphasize na hindi naman doon napuputol eh. No? Ika nga, pinakikita lang namin ano yung epekto na pwedeng mangyari sa kanila while doing it in a very, very short period of time. But of course, no, ideally, they have to continue. And we can do it, well, we have different scenarios that we can offer our patients. No? Na either sa city clinic, sa home concierge, we call it home visits. Kasi there was a time nung nasa kalagitnaan tayo ng pandemic, we have clients na ayaw na ayaw pupunta sa clinic, ayaw na ayaw pupunta sa hospital. So they would request, pwede ba home service na lang? No?
Pwede. Pwede yung home service. No?
Of course, we do. Pwede, mabibit yung mga instruments na iba. But at least through the IV, we can do it in the comforts of their homes. No? So
okay. So, meron akong naisip. Di ba, taon-taon yung mga tao nagpapa-executive check-up. Kasama yung colonoscopy, lahat na. Ano kaya kung magpapa-treat muna sila, pagpa-cleanse muna sila sa European Wellness bago magpa-executive check-up? Will that help?
Yes, that would be a good option. Kasi yung iba nga kaya nga, this is one typical example. After the Christmas holidays, ayaw ng mga pasyente magpa-executive check-up. Kasi dami they are anticipating na mataas yung blood sugar ko, mataas yung cholesterol ko sa dami ng kinain ko. So they will postpone it and then make sure that they would do something muna, hopefully to improve their overall situation. So that's very, very practical. And ganda yun na. Right.
Okay. Very good. Doc, ilan ba ang mga facilities nyo sa Anya Resort? Can we take a look at the photographs now?
Yes.
Ayan.
Ma'am,
What are we looking at?
excuse me, itutuloy ko lang. The other program under our breath program, aside from the immune system, is what we call the post-COVID rehabilitation.
Oy, maganda yun. Alam ko ninyo, Doc, meron akong mga ilang kaibigan na hanggang ngayon, kahit 3 buwan na o 6 na buwan na nag-recover na sila sa COVID, pabalik-balik ang kanilang ubo.
Right.
Yung feelings of exhaustion,
Yes,
fatigue.
tama yun, ma'am. I was about to say that. Maraming pasyente kasi, or sabihin na natin naka-recover from COVID-19 infection kasi negative na yung kanilang antigen test, negative na rin yung kanilang RT-PCR, and then nagko-complain lang sila, sabihin nila, Doc, bakit before tinamaan ako ng COVID, hindi naman ako madaling mapagod, hindi naman ako madaling para akong hina, na sometimes para akong may lagnat, na parang, there's this, so now, meron tayong mga tinatawag na post-COVID syndrome, where a lot of clients who have fully recovered from the infection are still suffering from, lingering manifestations or feelings of ill health, iba-iba. So that's also one reason why we wanted to address.
Post-COVID package ninyo, ano yun? Ano ba ang nilalaman ng package ninyo?
Okay, again, itong post-COVID package namin would entail a 8-day, 7 nights inclusion. No? So, meron kaming programs intended for patients. Kasi, yun na nga mamay, kanina, no? The 4-day, 3 nights, as well as the 8 days, 7 nights program, kung tutuusin, napaka-exec. But the point is, we're trying to make sure that our clients or patients are able to feel the impact of these treatments. No? Of course, it's inevitable. We always say that, of course, you need to continue. Pero dapat may pagsimulan eh. Kasi without experiencing the program, how do we know? And how would the patients appreciate the impact of these health benefits? So talagang kailangan Now, as I said earlier, then we also have other options that patients may choose from. No? May mga options like yung city clinic, yung tawag dito, yung home concierge if they really want to. So it's ang importante lang is maintindihan nila. All of these services are intended to improve their overall health. Kasi at the end of the day, what we want is longevity, di ba? Wala namang...
Dapat 101 ang target natin, Doc.
Yes, exactly. Right. We have patients who are in their 80s, but they still wanted to live longer, productive. So, ganun talaga yung intention natin. Kasi sabi nga ng Diyos, nasa kanyang awa, pero nasa tao ang tawa. We need to do our part to make sure that we're able to address. So, yun man. And slowly deviating from the conventional way of treating patients in the four walls of the clinic or hospital.
Doc, ilan ba ang mga facilities nyo sa Anya Resort? Can we take a look at the photographs now?
Yeah, definitely. We want you to experience the services we do in Anya, as well as, of course, the ambiance ng Anya Resort. So, maganda. Yeah, definitely.
Ilang rooms available para sa detoxification and cleansing?
Okay. So, ang setup namin is, ang Anya kasi is by villa niya, no? It's not a typical parang condominium hotel, it's a villa. So marami
Ilan ang villas nyo, Doc?
rooms. And wait, you caught me. Kasi we have about 12 villas, and in one villa, 8 rooms.
Oh, okay. Marami rin yun.
So malaki rin. What is good is that, the feeling is that it's very homey. And then the environment, makita maraming trees, maraming plants, maraming, so iba yung dating niya. And then there are activities that they do for our clients. And by the way, ma-mention ko lang, part of the programs support the nutritional aspect. And that's where the chef, the team of, there are 2 major restaurants, yung Sanira and may sakit ako sa
Pero Doc, matanong ko nga, Doc, we can flash it on the screen, yung mga mga facilities ngayon, para pagmasdan po natin mga katribo yung mga facilities nito. Anya Resort sa Tagaytay. Pero may nagtanong sa akin kasi nagte-text diretso sa akin eh. Ang tanong nila, kung magbo-book sila at mag-avail ng kanilang wellness package sa inyo, strictly enforced ba yung vegetarian diet?
Well, hindi naman Again, when we talk of the holistic approach, because sabi natin, mind, body, and spirit. So, syempre, there are ideal situations, ideal conditions. But of course, hindi naman. Kasi for us, that includes me, na hindi talaga sanay sa vegetarian, to be honest about it.
Ako sanay sa vegetarian diet, pero yung mga iba na hindi pa sanay, what kind of cuisine do you offer?
Anya offers a lot of different cuisines, depending on what the patient would prefer. So it's a preferential choice. But of course, we also suggest some meals that are swak dun sa ginagawa natin. Dun sa mga procedures that we do. Yeah. So, but
I'd like to invite our friends, our mga katribo na bumisita sa Ananya. Pwede pa silang mag-day visit muna para they can get a feel of the place?
Yes. I think so. They can do a day visit, familiarize themselves with the atmosphere.
Have lunch there, relax.
Yeah, exactly. We also have clients, by accident they wanted to have lunch, and then the staff of Anya, we call them the AE, Anya Experience personnel, would also invite them to see the services that we offer in European Wellness. So,
Doc, can we flash on the screen the photograph of
of course,
resort?
kita namin. Oh, definitely. We will do that.
Yung Anya Resort, I have to stand corrected. Anya Resort is in Tagaytay, mga katribo. Anya Resort, tama. Okay. So, yung Anya Resort ay isang wellness destination na pinag-uusapan po natin ngayon, kung saan andito rin si Dr. Ariel Baira, siya ay medical director doon, correct? Together with European Wellness. Meron kayong tie-up, Doc?
Yes, it's a partnership. So I am there Thursdays, Friday, and Saturday. But our nurses are available actually from Monday to Sunday. So they're there to render all the services needed. And if there are concerns that on their level they may not be able to address, then they call me up. I am 24/7 available. So anytime they they just call me if I'm not there. But Thursday morning, I'm already there about 9 o'clock until about 6 p.m. Friday as well and as well as Saturday. Because we always anticipate that clients would book in, usually will be towards the end of the week. So, the end.
Doc, ano yung exact location ng Anya Resort sa Tagaytay?
Okay, it's in somewhere in Buena Vista. Well, we will flash it, Buena Vista area. It's not along the highway of Tagaytay, kasi masyado maingay doon. So, since this is a resort, it is nestled in a relatively quiet area. So we will also flash them. And for sure, for those who are not so familiar ang ways, or yung, what's the other one? It's a Google Map. Surely will not miss Anya
So,
Resort.
Doc, bakit nyo napili yung Tagaytay bilang location ng Anya Resort?
Well, una-una, ang ganda-ganda ng climate ng Tagaytay. Of course, with all due respect to Baguio, na malamig, very refreshing. Madali siyang puntahan. It's just about, say, more than an hour's drive from Metro Manila. So, ang dali-dali pumunta, and then you enjoy, first and foremost is the climate. And malamig siya, even during summer, medyo lalo na sa gabi. Parang pwede ka na hindi mag-aircon sa loob ng kwarto mo. Kasi malamig. And then of course, it's very refreshing simply because of the serene atmosphere that we have. Maraming trees, just like in Anya. Maraming plants, maraming trees. So, pati yung hangin na ini-inhale natin, parang ang feeling natin malinis. So, these are things. And then, of course, very important is the services that we provide. Kasi, bilang doktor, responsibilidad ko yan . We are also changing the landscape of treatment. Hindi pupunta yung pasyente, may sakit na. Sometimes malala na, just like in some cases of cancer, pupunta sa'yo, galing na sa sobrang dami ng doktor, oncologist, and then sinabihan na sila, tinaningan yung buhay nila. Things like this. Of course, we don't give up, and we have alternative forms of treatment. But then again, the most important kind, in fact, sabi ko nga lagi, the ideal patient is someone na wala pa siya masyado, kung po pwede, wala pong sakit.
Yes.
Kasi,
so, Doc, ang sinasabi nyo, isang spesyalidad ng Anya Resort at ang European Wellness ay ang prevention.
Exactly. Yes, ma'am. Yung preventive. Kasi,
paiwas sa sakit.
Yes, paiwas sa sakit. Hindi, wag na natin hintayin tayo magkasakit pa. Ang pinakamahalaga is kumahanap tayo ng mga paraan na that will prevent us from getting any of these serious lifestyle diseases na ngayon tawag natin. Hindi na siya degenerative because marami nagkakasakit, bata pa . So again, kung ikaw ay bata pa, hindi mo pwedeng sabihin, Dok, bata pa naman ako . Nowadays, sa sobrang hindi magandang lifestyle ng tao, sedentary, maghapon nakaupo, nakatitig sa laptop, naka-text ng text and all. Walang physical activity.
Naninigarilyo.
Vices, of course. Lakas uminom. And then the food that they eat, puro fast food. This will all shorten our lives.
Doc, pwede ba kayong magbigay ng payo sa ating mga katribo that they can do at home, kaya nilang gawin sa bahay?
Okay, first, of course, is let's try to address the poor dietary habits ng tao. Kasi puro nga tayo fast food. Puro tayo puro mamantika, no, na kinakain. So try to take a lot of veggies, no? Pero dapat hindi rin laging sinasangkot siya. Kasi no, you can steam them, if you can eat them raw,
Right.
better, no?
So, gulay.
Gulay, number one. No? And then make sure na hindi kayo nakaupo all the time.
Oo nga, dapat nakatayo. Tayo muna tayo.
Tayo, lalakad, no? No? Hindi ko naman sinasabing kailangan yung mga rigorous exercises, no? Physical activity entails regular body movement.
Okay, so exercise every day.
And then, of course, water also is very
Tubig,
important.
hydration, hanggang 15 basong tubig araw-araw.
Yes, exactly. Sabihin nyo ba, kaya ko ba? Yes, kaya na. Kahit na isang basong tubig every hour.
Correct.
Alam mo yun, especially pag mainit. Because lalo na sa mga kababaihan, ang hina nila uminom ng tubig. No? So, water is...
Yung mga seniors, Doc, yung mga seniors, hindi nila nalalaman o nararamdaman kung uhaw na sila.
Exactly. Again, let me mention something about uhaw. Sabi nga, sa ilang studies na ginawa, hindi na dapat ang tao makaramdam ng uhaw bago uminom. Okay? Anong ibig sabihin? The moment you feel thirsty, kapag ikaw ay nahuhuhaw, that is already the sign of initial mild dehydration.
Yan ang sinasabi ko palagi, Doc. Ayan mga katribo, wag na tayong maghintay na mauuhaw po tayo. Nauhaw na tayo. Kasi ibig sabihin, talagang dehydration na. May dehydration sa loob ng katawan.
Masama sa katawan natin.
Okay, so pang-apat yun. Another tip, Doc?
Well, what else can we include? Of course, yung supplementation, or sleep. Again, no, one very important aspect that we need to follow is good sleeping habits. Kaya nga tayo may tinatawag na biological clock. The biological clock is from 10 p.m. to 6 a.m. Bakit? Na-discover din sa mga pag-aaral na during those times, doon nagre-recuperate, nagre-rejuvenate, namamahinga, kumukuha ng lakas din yung ating mga internal organs. Because from the time we are awake until the time we sleep, gising din sila nagtatrabaho din sila. So kailangan din nila magpahinga. So that's also the reason kung bakit when we wake up in the morning, pagkagising natin, diba? We feel very light, we feel energized, kasi nakapagpahinga din yung ating mga internal organs. So napakahalaga. That's the reason why pagka tinatamaan tayo ng insomnia, diba? Pag sa umaga, para tayong pagod, despite na nagalit tayo sa tulog, parang iba yung titakbo ng ating utang, ng ating katawan. That's the very reason why sleep is very important.
Now, can you invite our katribu to come and see you at Anya Resort or
Okay.
to see you at European Wellness?
Yes, of course. Sa ating mga katribu, hopefully makapasyal kayo sa Anya Resort Tagaytay. It's so easy to go there. It takes about more than an hour. Sometimes nakukuha ko nga ng 15 minutes lang. Pero huwag nyo na akong biyahin. Bisa kasi nag-experiment ako. Because there are several routes that you can go to para mapadali. But still, comparatively speaking, madali lang pumunta ko. And you will feel the ambience. It's a different ambience. As well as, of course, to experience our wellness treatment modalities, services that we do there. because the intention really is to make sure that you're in tip-top form. No?
Yan, mga katribo, ito po ang mga contact numbers ni Dr. Ariel Baira at ng Anya Resort at European Wellness. Ayan po. Call now. Doc, sana may incentive naman ang ating mga katribo. May discount.
Oh, yes. In fact, may mga promos kami na because our intention, more clients to come and experience our services. So definitely, meron tayong marami tayong promos na pinamigay sa ating mga
Ayan. Maraming salamat, Dr. Ariel Baira ng Anya Resort at European Wellness. Yan po mga katribo ang mga tips galing kay Dr. Ariel. Always remember ang basics po natin. Eat healthy, drink healthy, get enough sleep, exercise, manage your stress, eat nutritious foods, especially kung hindi, mag-supplementation po tayo, and have a heart that is calm and peaceful and loving. Yan po ang ating mga wellness tips sa hapon na ito sa Kalingang KaTribu. Ito po si Cory Quirino. Stay safe, everyone.
Thank you.